Good afternoon. My presentation today will be on health issue of HIV and AIDS in Mozambique, Africa. Okay, let's go. Definition of HIV and AIDS. Human immunodeficiency virus is a virus that attacks the cells that help the body fight infection, making a person more vulnerable to other infections and diseases. AIDS, acquired immunodeficiency syndrome, is the late stage of HIV that occurs when the body immune system is badly damaged because of the virus. HIV can lead to disease called AIDS. The reason being is the body can't get rid of the virus on its own, nor is there a cure. So once you have the virus, you have it for life. There is antiretroviral therapy available to lower the viral load. By lowering the viral load in effort to reach suppression to the point where the load is so low that the lab can't detect, in which this is low called undetectable viral load. Without HIV medication, people with AIDS survive only about 3 years. And if presented with dangerous opportunistic illnesses, can lead to dying up to as early as 1 year. According to official estimates, at least 48,000 people died from HIV and AIDS in Mozambique, Africa in 2022. And further, 97,000 were infected with the disease. 2 million people with HIV are on antiretroviral treatment, a virus that mainly affects women between ages 15 and 29. Next, we'll discuss health barriers. Health barriers are contributed from culture influence health outcomes, belief in traditional healers, high cost of and availability of drugs, lack of social and family support, and finally, lack of self-efficacy for medication taking. Health-seeking behaviors in Mozambique. There have been significant improvement in healthcare. Numerous individuals still die from the disease, however, for which treatments have been established. Some of these illnesses that fall in the category are alignments such as diarrhea, pneumonia, malaria, and HIV and AIDS. Not properly looking for health care is one of the factors contributing to poor health outcomes, including death in people suffering from these illnesses. The government healthcare services that are readily available based on modern medicine are viewed as the norm. In theory, all citizens have access to these services. Health-seeking behaviors have shown improvement. Numerous individuals still die from the disease, though. Because culture affects the outcome, with the effects of fluctuating good and bad, it is necessary to understand from a cultural summary and why people don't choose the treatment routines available by modern medicine. Cultural beliefs influence health-seeking behavior among Mozambians residents to the point where healthcare providers are not likely to culturally desensitize care without training and learning about the culture. Next, I will discuss the risk. Some of the risk of developing the virus is numerous sexual partners, extramarital sex, intimate partner violence, poverty and household wealth, infrequent or absent of condom use, and religion untreated sexual transmitted infections. The human immunodeficiency virus is the leading cause of morbidity and mortality in sub-Saharan Africa. In 2018, about 37.9 million people were living with HIV globally, with a disproportionate 70% living in sub-Saharan Africa. Effective use of antiretroviral therapies have advanced, increasing the life expectancy and quality of life of HIV infected individuals. HIV epidemic continues as a serious public health and financial challenge. Currently, Mozambians is amongst the top 10 countries with the highest rate of HIV. In 2018, an estimate 2.2 million people were living with HIV, and there were 54,000 reported HIV-related deaths. Cultural practices among Mozambians, such as cleansing rituals for widows and widowers, which vary from region to region and are gender dependent on the partner violence, poverty, household wealth, and infrequent absences and use of condom. Other include like your religion, having an untreated sexually transmitted infection such as herpes simplex virus type 2, movement, migration, and rural resident status. Next, we'll discuss some of the solutions, the strategic focus. The focuses will be the support of integrated prevention and treatment services, responding to HIV/AIDS, and mitigating the impact of COVID on HIV and AIDS epidemic. The program will deliver HIV prevention and treatment services in a 250-bed health facility by offering practical and financial assistance to the country's size to reach AIDS globally epidemic control targets, with focus on interventions that improve reasonable coverage of HIV services among the vulnerable and hard-to-reach populations. The program will be committed to planned HIV case findings and preventing new HIV infections through voluntary medical male circumcisions, pre- and post-exposure prophylaxis, and programs for preventative of mother and child transmission. Key populations are adolescent girls and young women and gender-based violence. The programs will be committed to client-centered services, putting all HIV clients on antiretroviral, providing differentiated services, delivery models to improve HIV treatment and retention, and ensuring that patients have suppressed HIV viral loads, ultimately reducing the morbidity and mortality and transmissions. Some of the conditions have here are top 10 causes of death in Mozambique. We have malaria at 29%, HIV at 27%, perinatal conditions at 6%, diarrheal diseases at 4%, pneumonia 4%, accident and external causes 4%, circulatory diseases 3%, tuberculosis 3%, and malignant neoplasms at 1%. So the higher two are right there at malaria and HIV virus. Mozambique has a widespread HIV epidemic. The HIV occurrence among men and women, of course, like I mentioned before, is ages 15 to 49, and estimated around 11.5%, which are high rates. Tuberculosis and malaria worsens the impact of HIV. Our programs that we're going to support the government of Mozambique will be addressed the HIV/AIDS epidemic in the following. We will increase medical male circumcisions, we will support and prevent mother-child transmission, deliver planned HIV testing, build greater volume of fully combined positive prevention. We will provide post-exposure prophylaxis, employing a standard-based approach for the medical infections, implementing HIV prevention for most at-risk population, and support a field epidemiology and laboratory training program, conduct HIV surveillance behavior surveys, and designing and improving systems for routine program monitoring, developing research capacity, and finally, enhancing human resources and investigation and information processing. Next, we'll discuss the cultural determinants, starting with Islamic faith influence is their decision making, the family dynamics, health practices, risk, and use of healthcare. Muslim patients cause challenges for health professionals, making it difficult to treat. Cultural biases such as fear of mistreatment, distrust of care providers, and ethnopathogenic perspectives. Muslims are accustomed to traditional healers to deal with illness, particularly those illnesses that were said to be caused by spirits. Since traditional medicine has been around for hundreds of years and modern medicine hasn't due to cost and accessibility, the lack of trust in the healthcare system, the Muslim culture has relied on traditional healers. In Mozambique, there has been significant improvement in healthcare. Several people still die from diseases which treatments have been recognized. Some of the illnesses that fall in the category are in alignment with the diarrhea, pneumonia, malaria, HIV. Not properly receiving healthcare is one of the most factors contributing to poor health outcomes, including death in people suffering from malaria and HIV. The program proposal will include innovation, technical package, managing performance, partnerships, communication, and political commitment. Some of the goals for the program will be electronic health information, access to care and availability, human resources for health, strengthening laboratory systems, expanding information systems infrastructure, development of system for monitoring and integration, research and survey conduction, and promotion of the country's own sustained health system. Some of the objectives are: the program will provide educational resources, healthcare assistance, and opportunities for citizens to interact and receive care from public health officials, health authority. The program will reduce the spread of disease from 60% to 40% within 6 months of implementation of the program. The program will have at least 10% reduction in the new cases of HIV virus in 6-month time period. And the program will enhance availability, accessibility, and deliver health care within Mozambians as it relates to HIV and AIDS virus. And finally, the program will employ, educate, develop awareness of HIV within the Mozambique community for 1 year, within 1 year. Budget for implementation will be program administration at $30,000. Health planning and system enablement will be about $15,000. HIV and AIDS health will be right around $30,000. Healthcare services around $10,000. Hospital tertiary services and human resources development $50,000. And healthcare regulation and compliance management around $20,000. And we'll take off $10,000 from the donation from Liberty Health Mission Board. That was a donation to the program. And last but not least, the way we will evaluate a company evaluation strategy for the program will be implementation with verification that program activities were put into place as originally intended. Effectiveness will verify that the program achieved the goals and objectives it was intended to accomplish. Efficiency, did the program's activities produced and with appropriate use of resources, budget, and staff time? And cost effectiveness, did the value or benefit of achieving the program goals and objectives exceed the cost of the program to produce them? And here are the references of where I found my information, and that concludes my presentation. Have a good day. Bye.